vertebral 12, like a thoracic spine, that's gonna be the end point, and it become the descending area, become the abdominal area. So when you are tracing down, it's gonna be not that long, because when you pass the oblique, so then it's like a short like this much. So you're gonna trace it a little bit, and to find the pulse from the umbilicus, not the lateral to a little bit to the left side, and a little bit higher up, then you can feel the pulse. It's easy one that you can feel. And the abdominal aorta, when you pass the umbilicus area, it become the common iliac artery. So it's like short like this way. And then you need to landmark their inguinal ligament first, like where the ASIS, and then the tubercle on the pubis, and like it's here, right? So from the common one, it becomes the internal that goes to the inside of the pelvis, and then the external one. So external iliac artery is quite short too. So like from the umbilicus, like kind of halfway is gonna be the common, and halfway it's gonna be the external iliac artery. So when you're tracing it, it's really short for the iliac, external iliac artery, and then when it passes the inguinal ligament, it becomes the femoral artery. So finding the pulse is gonna be in between, like middle point of the inguinal ligament, and then you can feel the pulse this way, which is quite superficial too. And then after it passes the inguinal ligament, the external iliac artery becomes the femoral artery that goes along medial to their femur, and then it passes through the adductor hiatus, and it goes to the posterior side of the knee, and then it becomes the popliteal artery, right? So the tracing it's gonna be short from passing the inguinal ligament from the iliac, the external iliac artery, and then femoral artery up to here, and then the popliteal here. So finding the pulse is gonna be same spot, inguinal ligament, and you're gonna go in the middle point of it, then you can feel the pulse right away. And then when it passes underneath of the knee joint, like it goes like this way. You cannot see it. I can show you later after I done the anterior tibial artery, because I don't want to flicker too much. So from the popliteal artery, it's punctured through the interosseous membrane, like the superficial, the superior part of it. So there is a tibia, and then the fibula you can feel, and it comes out between those there. And then it's gonna be the same tracing like the which nerve? Deep peroneal nerve, right? So you're gonna go along the anterior compartment of the leg, all the way down to their foot. So finding the pulse is where it becomes the dorsalis pedis here, right? So you're gonna go to the anterior side of their ankle joint here, and then there's a tendon you can feel it. It's in the hallucis longus. And then you're gonna go lateral to it to feel the pulse. So it's gonna be easy to feel the pulse for the anterior tibial artery, and then the dorsalis pedis is from here to all the way to the dorsal side of the foot, and then you can find the pulse there, same spot for both. And can I have you facing down? So there is a popliteal artery coming off from the after it passed the femoral artery past the adductor hiatus, it becomes the popliteal artery. It's kind of short. So to find the pulse, you need to have your patient relax their leg, and then you're gonna deepen your fingers deep in, like in that position. Then you can feel it. Like you need to find the middle line of their joint line, and then deepen your fingers. Like if you feel the tendons, you need to go in between, in the middle, to feel the pulsation. The pulse is not too much, so you can feel it here with the popliteal artery. And then after it passes the soleal line, and it becomes the posterior tibial artery, so you need to follow along the posterior side of the tibia bone, like the tibial nerve, right? So then where it goes, is it posterior to the medial malleolus or medial? Posterior, right? Posterior to the medial malleolus, and then it goes to the bottom side of their foot, right? So to find the pulse, you're gonna put your fingers posterior to their medial malleolus, and you can feel the pulse. And then, so small cephalous vein, we can do it in this position. The small cephalous vein is coming from the lateral side of their foot, and then goes all the way up along and then it goes to the popliteal vein in the popliteal fossa and drains into the popliteal vein. Gray cephalus vein. We already talked about it. It's the same route, right? So you're gonna starting from the medial side of the foot where the great toe is, and then go anterior to the medial malleolus, and then medial side of their lower leg, a little bit closer to the knee joint, and goes all the way up to the inguinal ligament and drain into the femoral vein. It's the same, just different direction. It goes here. So if you cannot find the purse in a prone position on your patient, the other way you can feel the purse for the popliteal artery is in a supine position. Sometimes it's easier to feel that way. So you can have your fingers hooking on like this to put posterior to their knee. You need to relax your leg. And then you're gonna deepen your fingers in the middle line of the joint, then you can do it here. So either way is fine. Like tracing, it's easier when you have your patient in a prone position. That's why I try to do it. But if you cannot find the person in that position, then you can flip your patient over and then feel it that way. Then sometimes it's easier. Any questions? So we can have break 15